Thank you for joining us today for another episode in the Clinical Pharmacy Pathways series. I'm excited to have Eric Peterson here. He's a clinical pharmacist at Children's Hospital, Colorado. Thank you so much for joining today, Eric.
Thank you for having me.
Absolutely. So as you know, in this series, we discuss various clinical pharmacy pathways. Let's have you first start off by telling us about yourself and how you got interested in pharmacy practice.
Oh, of course. I would say I had a more traditional pathway into pharmacy. So I actually am from the Denver region. I went to school here at the University of Colorado, and then I ended up going to pharmacy school at the University of Colorado Skaggs School of Pharmacy. And I graduated from that program in 2017. And from there, I went on and did my pharmacy residencies, both PGY1 and PGY2 years. And the PGY2 was in infectious diseases specifically. From there, actually, which the residency was out of state, so I moved back to Colorado after that, and I got a job in a totally different field than what I trained in. So I'm working in pediatrics now, and I'm working for Children's Hospital Colorado. I'm working at one of their smaller hospitals, actually, which has a focus. The role has a focus in the emergency department. But there are some roles in some other service areas as well, including our inpatient units, infusion centers, as well as our clinics. So the role is very broad, which I like. It's also got a decent mix of clinical and operational duties. So I get to work with a lot of different people and do a lot of different things.
Sounds like a great role and a lot of different variety and various clinical and operational duties within your role. So it sounds like your pathway in clinical pharmacy kind of started progressing when you pursued a residency program. How did you decide to complete a clinical pharmacy residency while you were a pharmacy student?
Sure. So I didn't know at first that I wanted to do a pharmacy residency, and I think that's common for pharmacy students. Like most people, I didn't have a ton of exposure to what clinical pharmacy actually meant before I got into pharmacy school, primarily because I worked as a pharmacy technician for a local retail chain before entering pharmacy school. So I just didn't really have a concept of what clinical pharmacy was. And fortunately, when you enter pharmacy school and you're in your second or third years, you get more and more exposure to the hospital system through things like your like the introductory pharmacy practice experience or the IPPEs. So you can kind of get some exposure to some different areas of pharmacy, and hospital being one of those. And when I did mine, I actually went to a small community hospital medical ICU, which was a great experience. I ended up doing one of my pharmacy rotations there, and it just really exposed me to what clinical pharmacy could be. So at that point, I really decided that I love the critical thinking associated with clinical pharmacy. I just love the environment, and that's when I really decided that I wanted to pursue residency. And then I had to reach out to all of my my mentors and peers and really just come up with a plan for how I was going to do that. So, that's something else, that I was really involved in. And then ultimately, I was fortunate to match with a program.
Awesome. Now, in the process of choosing to go for a pharmacy residency, there's a pretty intensive process to go about in selecting your program, applying, and ultimately beginning it. So can you tell us a little bit about your residency application and selection process and what factors you use to determine how you wanted to rank your residency programs?
Of course. Yeah. I think it's one of the most stressful things about the entire process of getting a residency. Not to mention that you're having to find programs while you're on rotation. So it's in addition to all the other things that you're doing. And when you get on the ASHP directory website and you look through all the programs, it can be very daunting. There are so many programs that you can't possibly look through them all. And so you really need to find some way to narrow that down. And I think for me, that the important thing to look at and what I would recommend for people to look at is, what do you want out of a residency program? Do you want things like critical care or infectious diseases? I think you'll have a lot of opportunities at a lot of institutions because most places offer some rotations in that. If you have an interest in something like solid organ transplant, then you're maybe narrows your list a little bit because you have to go to these large tertiary care medical centers. So those kinds of things can really narrow down your list. I think if you're interested in things outside of clinical work, so things like leadership, precepting, giving a lot of presentations. Like if those are things that are interesting to you, you can find programs that have an emphasis in that when you're researching, and that really helps narrow down the list as well. I would say some lesser factors are going to be things like how many other pharmacy residents do they have? What's the geographical area? Those are kind of smaller factors that can come into play that can also help you kind of fine tune what programs you're applying to. And then once you actually are in the process of I've interviewed with these programs and I need to be ranking them, there's a lot of stress associated with that too, because it can be tricky to know how you want to rank the programs. And I think one thing is, do you feel walking out of that interview that you fit with the program? Do you feel like you're going to interact well with the program director for the next year? Because if not, it's going to be a long, stressful year as a resident. And it is anyway, so there's no sense in adding to that with unnecessary burden. And then on top of that, some people like to think about, is this program really prestigious, or does this have all of the rotations I want? And those are factors to consider as well. I just think that it's not going to be the most important factor in making that decision. Some great advice that I was given when making my rankings was, don't do it based on how you think you did. And I think a lot of people tend to do that because residencies can be kind of competitive to get. And so I would recommend against doing that, because you're basically just you're trying to settle for what you think you can get, whereas I think you should be going for where you think you're the best fit.
Absolutely. I think that's great advice. Looking at pharmacy residency programs, there's so many different factors to consider. It can get so overwhelming. Also, on top of that, I think students get worried about where is the right place to go or the best place to go. And I really don't think those necessarily exist. Like you said, it's all about finding the best fit for you. What experiences are you looking for? How can you optimize that in your journey and get the most out of it and take control of that experience and that journey? So I think that's great advice. There's really no right and wrong in all of this. It's just finding what's best for you and what's the right gut instinct that you feel like is the best fit for you. So great advice there.
And I may jump in because you actually, you just made me think of it. So you had mentioned, going to the quote unquote best place. And I think that that's something else that, it's really, I think we have a tendency as pharmacy students to kind of gravitate towards those tertiary care medical centers, huge academic centers. And those are great programs. Like there's a lot of great programs there, but I definitely don't want to dismiss all of the smaller programs at the community hospitals and those kinds of things, because I did my PGO and residency at a community hospital, and some of my best preceptors have been in that setting. It's just a little bit different feel, and it's just something to get used to, but you can get great experiences at both. So definitely don't rule out those kind of programs.
Absolutely, completely agree. So tell me about your residency program. What did it all entail, and what were the most valuable skills that you learned from your different experiences, both clinical and project work?
Sure. So, during my residencies, I think most people tend to focus on the clinical aspects, which I think is really important. And I learned a lot of clinical skills, both in my PGY1 and PGY2 residencies. As expected, my PGY1 was much more broad, and it was just a general pharmacy practice in the hospital residency program. And so I got experiences in multiple different settings, like internal medicine, critical care, emergency medicine, oncology, and I got a lot of project work on top of that. And in addition, you have things like staffing responsibilities where you're working by yourself. And so that's largely what encompassed my first year residency program. My second year residency program was, of course, more specialized in infectious diseases. So all of the rotations were focused in that, things like rounding with the ID team, doing antimicrobial stewardship. I was with microbiology, infection prevention, and that's really what made up the bulk of my rotational experiences. I would say the most valuable thing for me actually came outside of my clinical duties, especially during my second year. And so that largely encompassed doing things like quality improvement, developing my leadership skills. And those are things that that most pharmacy students and residents maybe don't focus on. But those are skills that you will definitely take forth into your career moving forward. That's not to discount clinical skills, because you learn a ton of clinical skills, but you also will keep learning clinical skills after you leave. You'll enter an environment that isn't exactly what you were in, and you'll learn new things, and you'll learn how your hospital does things in the future. And so there's always learning associated with that. But for instance, one of the things that I think I learned a lot during my PGY2 residency was about things like quality improvement. So having an idea or developing a question about how we can improve clinical care, and then from there you can pull information. You talk to key stakeholders, and you develop a plan for a guideline or a policy or a procedure, and how you want to implement that at your hospital system. And then when you put in all the work, it gets reviewed by your peers, and they make their recommendations. And so you learn to work with them and incorporate that into your into whatever it is you're making. And then from there, you have to really learn how to take that through committee and get that approved and get their feedback. And then you can implement it and then do more education. And then afterwards, you can go back and you can look about how well that went. How did you do through the process? And then ultimately, how did the intervention change practice? You can go back and look at that. And so that's a really valuable experience for a pharmacy resident. And many people don't feel comfortable with that. Many pharmacy residents, many pharmacists don't feel comfortable with that. So that's a very valuable skill that I developed. And it's something that translates well into any setting. And then just all those leadership skills that you develop through precepting students and giving presentations, continuing education, all of those things a lot of people aren't comfortable with, but you get exposure to doing residency. And that just really helps develop you overall as a clinician.
Excellent points. I think you've encompassed so much of what we learn throughout residency. It's not just the clinical skills, although those are the core of what we learn in a hospital pharmacy residency. But you mentioned, project development, seeing a project from coming up with the idea, originating that thought, and then implementing, seeing it to fruition, and then evaluating the outcomes. So powerful. I think a lot of the great developments that we've seen within hospital pharmacy have come about from residents starting those and initiating those projects and getting them off the ground to make huge impacts within the profession. I also think, time management, presentation, soft skills that you mentioned, in public speaking, in managing your time and your resources to be able to develop relationships within not just the clinical team, but across departments, and sitting on a lot of those committees to be able to make that impact in clinical pharmacy. So excellent points. I think, our viewers who are watching will really get a better sense of what it means to do a pharmacy residency. It's not just sitting up on a hospital unit verifying orders. There's so much more to that to be gained, and it's really about that whole experience and what you make of it. So very great points. I'd love to hear about what your specific challenges were and what valuable lessons you gained in your transition from resident to new practitioner, and what were the biggest skills that you learned from that?
Sure, absolutely. So I think I probably encountered similar skills to what a lot of residents experience transitioning to being a new practitioner. Maybe mine were a little bit more so because, like I said, I trained in infectious diseases and then I transitioned to pediatrics. So upon transitioning from being a resident to a new practitioner, for me, there was a whole new skill set that I had to learn. It wasn't something that I had a ton of exposure to during my residency. So there was definitely some clinical learning that really had to take place. But I think beyond that, one of the biggest things that I encountered, and I think a lot of residents encounter transitioning, is during pharmacy school and during your residencies, there's constantly somebody behind you kind of pushing you forward. For instance, during residency, there's so many requirements that really have to be met. So you have all of the rotational requirements, and you have some longitudinal projects. You have to do a drug utilization review and a monograph, and really just you have so many things that you have to get done in a year that one of the program director's primary responsibilities is just to kind of keep you on track. And so that means that there's constantly kind of pushing you forward, just making sure, everything's going okay. And I think once you transition to being a new practitioner, a lot of that push is gone. Of course, whoever you're reporting to, whether it's a director, manager, or supervisor, whatever, is going to want you to grow, and you're going to have some responsibilities associated with the role that you're in. But beyond that, if you wanted to do any of those things, like that's totally up to you. That motivation now has to come from within. So if you're interested in something like I am, quality improvement, and really it's up to me to kind of evaluate and kind of decide I want to do that. If you're interested in precepting, you have to be contacting the school and sign up for students and those kinds of things. So I'll say for me personally, when I got in my role, I really just spent a few months kind of getting used to the system and the workflows and all of those things. And then after that few months was up, I really started asking questions, and clinical questions that I think I could work on. And then from there, I started going through that whole process again. Ask a question, pull data, those kinds of things. And so, but that wasn't a requirement for me. And so I think that that's a little bit challenging for some residents transitioning, is that now they might spin their wheels a little bit, not knowing what they need to do. But they'll ultimately just have to find out what they want to accomplish in their job, and then they can go from there.
Absolutely. There's a lot of support that's provided, not just by the residency program director, but also a residency program coordinator and a potential advisor and mentors and preceptors. You have all the support that helps you make strides forward within your residency program. But once you become a new practitioner, a lot of that is gone. And so it's really up to you to seek out those experiences, seek out the resources, seek out the support and help to be able to continue moving your professional goals forward. And I think some people may start to feel untethered, and they may not feel like they are able to take it upon themselves to have that autonomy. So I think, honing in on that for our viewers who are going to be going through residency, really thinking about your self-directedness and your ability to become a lifelong learner, I think is key. So Eric, you make a great point in that. And I'd love to hear more about the differentiation in the transition that you just mentioned compared to the transition that you had as a pharmacy student becoming a pharmacy resident. How did that differ for you?
Oh, of course. So I think for me, the student to resident transition was probably more difficult. And I'm pretty sure that that's going to be common for most people, because you're not only transitioning from one place to another, but I still have my pharmacy license. I'm still familiar with how to evaluate patients and look at orders. Once you're a student transitioning to a resident, then you really have to worry about getting licensed. You're worried about moving more than likely for a lot of these programs. And then you're just learning, how do I verify orders? How really does a hospital workflow go? And so that's why I think that can be a little bit more challenging. You can kind of feel like a fish out of water. I think, I don't think students really realize, myself included, like how much you don't know until you actually start your residency. And that's when you really see that, there's like, pharmacy school not fully prepare you for a residency, because it's only 4 years. Like, they can only teach you so much, and there's so much information out there. And that's not to discourage people from doing residency or to make them feel inadequate, but that's all part of the residency growing process. And so, don't feel discouraged by that. But there is a big transition, because you're having to learn not only new knowledge, but what is clinically applicable knowledge from what you learned in pharmacy school, and getting licensed and all those things. So I think that makes that a little bit more challenging.
I would agree. And you make a nice point about, you don't really know what you don't know, right? You don't know until you experience it. And so many students want to learn about pharmacy residency. And I think just hearing your experience in navigating some of the challenges, navigating all of the different skills that are to be learned, can help better mentally prepare themselves. But ultimately, until you become a resident and you're wearing that white coat and you're on the team and a physician is asking you for a recommendation, I think that's when the self-directed learning and the autonomy start building up, right? And that ignition within ourselves starts revving up to be able to propel the profession forward. So, as a pharmacy student, if you're listening, as much as you can do to kind of learn about residency and hear about these different experiences, I think is great. Eric, could you tell us a little bit about the most rewarding and challenging aspects of your current role within the emergency department setting? We've talked a lot about the residency program, but for the residents that are currently listening, they might benefit from hearing how you have worked in your skills through residency into your current role?
Oh, sure, of course. So I think there's a lot of rewarding things working in the emergency department. I think one of the big things is it's usually is a great collaborative environment. So I have great relationships with physicians and nursing staff, respiratory therapists. And I think a big reason for that is because you're used to having to react to situations instantaneously. So usually, critically ill patients can be coming in the door. And so team members really learn to rely upon each other and trust each other. And pharmacy is definitely included in that. So I can tell you that it feels very rewarding when critically ill patients come in, whether it be, status epilepticus for me or diabetic ketoacidosis, primarily with pediatric patients, is primarily that I know if I'm not aware of it in advance, I'm getting a call. And so that's a great thing, is that they want me there and they trust my recommendations. And a big part of what that is being bedside. And so that's, for those more acute patients, that's going to be one of the most rewarding things, because that's the most hands-on that we get in the hospital setting. And so being bedside, drawing up medications, making like real-time recommendations to providers is something that you don't get in a lot of other settings. And so I think that that's a great learning experience. And something that I think is very rewarding on a day-to-day basis. I think aside from that, there's a lot of other things too. So you get to see a wide breadth of clinical things. So you get a lot of ambulatory things coming in. An example from a pediatric standpoint would be things like strep throat, otitis media. Like those are common things that you see in the emergency department, but you also get to see those sicker patients as well. So you can kind of get to use clinical knowledge from a lot of different areas, which I think is very rewarding. I think the main challenges that are associated with working in an emergency department are things like, handling high stress situations. So if you have critically ill people coming in, it can be very stressful until you get comfortable with, especially like, where is stuff? I have to go grab these medications and prepare them, and they're asking for them. And you can kind of learn to mitigate that over time, because you learn to anticipate needs. And so you can kind of do things faster, and you can kind of anticipate. And so that makes it a lot less stressful on you. I would say the other thing for me, because as I mentioned, I have a huge interest in quality improvement and projects and those kinds of things. Unfortunately, if you're in an emergency department, you can allot time for that kind of thing. But if patients come in that need your attention, like that takes priority. So for that kind of a role, you really have to be available all the time. And so that's something where, if that bothers you, maybe the emergency setting isn't right for you. I would say on top of that, the other biggest thing is just going to be, so some of the patients you see can be hard to watch. And because you are a part of the primary treatment team, like I said, I'm bedside for a lot of these, you basically get a front row seat to what's happening. And that's not to say that I'm an audience member. I mean, you're definitely participating in their care. However, that does mean that you unfortunately get to see a lot of things that can maybe be hard to watch. But I think that, typically you'll have a very good support system in place, to help manage those things. But it's definitely not for the faint of heart to be in the emergency department, because a lot of those things can kind of stay with you for a while. But I would say overall, the rewards far outweigh any of the challenges that I've mentioned, for working in the emergency department. I think it's a great place for a pharmacist to be. If you really think about it, it's one of the highest areas for drug errors. So we really need to be there.
Yeah, those are great points. I have a lot of respect for pharmacists and all healthcare providers that work within the emergency department setting. As you mentioned, a very high stress environment is the first point of contact for a patient, typically within the healthcare system, especially patients who are underserved and don't have a primary care provider. Some of them come there for those ambulatory needs, as you mentioned. And so there's such a wide variety and broad area of work that pharmacists can do both in the acute setting as well as in the ambulatory field within those patient care environments. I like that you also mentioned thinking on the spot. I think, within a clinic setting, you can have time to read patient notes, prepare information to disseminate to your patients and educate them on. But within the emergency department setting, you don't always know who's coming in. You'll get a call overhead and they're on their way, from a car accident or from a myocardial infarction, and you don't know who the patient is or any of their demographics, unfortunately. So it's great to be able to pick out tons of different clinical pieces right on the spot and be able to make quick recommendations as you do. So thank you for your service and what you do in the emergency department, especially nowadays within the pandemic that we're in. So we've talked a lot about clinical skills within pharmacy school, pharmacy residency, as well as your current role. I'd love to hear more about some of that leadership development that you alluded to. How do you currently pursue career and leadership development outside of your clinical duties as a new practitioner?
Sure. So I think that that's something, I think that's another challenge, that some residents find when transition to being a new practitioner is how do you continue to develop yourself as a leader, as a practitioner? And I think a big part of that, and it is really advocating for yourself. And that's not something that's specific to being a new practitioner. If you're a resident or you're a pharmacy student or you're doing your prerequisite work, it's really important to advocate for yourself and advocate for what experiences you want and how you want to grow. And because we always have a say in that. So in my current role, like I said, I got, for the first few months, I just kind of got used to the system and I learned the workflows and what our policies and pathways were and those kinds of things. And from there, I really advocated for myself, and I got in touch with multiple people, my primary manager, as well as some other people in the department who had leadership roles. And I reached out and said, look, I'm interested in doing this, and I'm interested in doing something. I want to help with infectious disease related things. I want to sit on a committee. Like, those are things that you can reach out and say as a new practitioner. And trust me, people are always looking for help on things. There's no shortage of need. So they're going to take advantage of that. It's just, you need to put yourself out there. I guess a few examples for me are, so we actually, a few things for me that I've actually done within the last few months has really been things like developing a new 30-minute continuing education program. So I've been in touch with our student services coordinator, who also does our continuing education. And then I worked with the University of Colorado Skaggs School of Pharmacy to really develop a continuing education offering that was shorter than 1 hour. And really developing how we're going to do that, material for presenters, what the deadlines are going to be, like all of that stuff is what I advocated for and I wanted to help develop. On top of that, there were a lot of other policies and stuff that I've been in charge of, like I've supervised some pharmacy technicians in some of their policies, and that's something that I hadn't had a ton of exposure to before, but by advocating for myself, I wanted to get involved in those kind of experiences. And so they definitely got me in on those projects. I would say additionally, I also got involved in a lot of clinical things as well. So things like I reached out to our the antimicrobial stewardship team here at Children's Hospital Colorado, and I said, look, I want to be involved with some of the projects, and they got me on them. So I'm actually supervising some projects from that standpoint. So there's always opportunities. I think that's really how you can develop yourself. And then I would say on top of that, you can also go outside of the organization as well. So you can look at some outside things like state organizations, national organizations. And for me, I'm involved in things like Colorado Pharmacist Society or the Society of Infectious Disease Pharmacists. And so finding additional opportunities where you can help develop yourself as a leader and as a pharmacist.
Great advice. There's such a big world out there, not just in clinical pharmacy, but pharmacy as a whole, healthcare as a whole, so many different opportunities. Like you said, it's really about finding your interests, putting yourself out there and seeking those out. They're not going to come to you. So in closing, what advice do you have for aspiring pharmacists who are interested in clinical pharmacy and who really want to set themselves up for success in this career path?
Oh, of course. So I think there's a few things. One is try to plan out in advance if you can what you want to do. Like I said, I had kind of decided in my second to third year that I was interested in clinical pharmacy. And it was helpful to know in advance because I could make decisions about my rotations and about my involvement based on that interest. So for instance, one thing I did was I wanted to get involved in some organizations, just knowing that I wanted to help contribute a little bit, network, as well as, just understanding that getting into a pharmacy residency can be pretty competitive. And so taking some additional steps to improve my candidacy. So getting involved with an organization, I helped develop a journal club offering through that organization as a student. So that's something that, like, those are the kinds of things that you can do, and don't be afraid to think outside of the box. Like, you can always start up something that you're interested in. And then when you're on rotations, like, you can help, that really helps decide what you want to do from a ranking standpoint. And then I would also say, when you're on rotation for that, if you're interested in clinical pharmacy residency, to really try to do something unique on every rotation so you can put that on your CV, and it really just adds an experience that you've had that you can speak to. An example would be that when I was on my rotations, I helped develop an antibiogram for one of my rotations. We developed some like antifungal recommendations. And that's something that you can do within the scope of one rotation. You just have to express that interest to your preceptor. And then that's something that you can really speak to at residency interviews. And that really speaks volumes to how much of a go-getter you are. And, that's just something that a lot of students, and a lot of times even a lot of residents, don't get a ton of exposure to. So I would definitely say, just try to kind of do something unique on each rotation. On top of that, I think what's important is never underestimate the power of like networking. That's something where I maybe didn't understand that as much as I should have when I was in pharmacy school. So that's maybe something I would kind of go back and, change if I could. But they always told me pharmacy is a really small world, and I think you'll really realize how true that is. And so taking advantage of every networking opportunity, going to conferences when able and talking with other people, touching base with, really getting to know your preceptors, and then getting involved in organizations. All of those things are great networking opportunities. And that's as a student, as a resident, after residency, that's something else that never stops too. And then I would say the last thing that the advice I would give is there's not one path to anything. I mean, I guess that might even be the point of this pathway series a little bit, is that there's a lot of different ways to get to your goals. So if something doesn't work out, don't be afraid to kind of change gears and find another way. For instance, not everybody has to do a residency to work in clinical pharmacy. Like that's definitely not something that has to be done. Now, there might be some other things you have to do, like you may have to go work some overnights, or you may have to go to a more rural setting in a smaller hospital because of how competitive it can be, depending on your area. But there's opportunities to get involved in what you are interested in. Sometimes it just takes a little bit of extra work and some creativity. But never be discouraged if you're blocked at one point or another. You can always find a way around. So I think those are the main points of advice that I would give to people, kind of moving forward.
Great advice, Eric. I agree with what you're saying, that rejection is just a redirection, and there's always different pathways to get to a certain point. It's really about honing in on what your goals are, what you want to achieve. As you mentioned, finding those unique experiences that set you apart, that show your passion and what you want to do, making it move forward. So I think just showing your interest, seeking out opportunities, helping drive that forward will get you to where you want to be in pharmacy, whether that be a clinical pharmacy or another work setting in the pharmacy field. So thank you so much, Eric, for your time and joining us today. Did you have any last thoughts or any last closing points for our audience?
I don't think any closing points. I just want to thank you for your time. I hope that this was helpful for anybody who's listening, whether it be students or residents or anybody else. And I wish everyone the best of luck.
Thank you, Eric. Take care. Have a nice day.
Thank you.